the financial challenges they faced due to the COVID-19 pandemic. We will be talking about the twists and turns with regards to the schools reopening, and of course also talking about the lessons that we draw from the impact of the COVID-19 in our education sector. It's a bad thing, yes. It is something that we never predicted as a country, but it has happened. COVID is here with us and we are battling with this particular pandemic. But what is it that we can learn from it? What is it that it is teaching us about some of the things that we have been doing, our way of life? And today we choose to focus on the education sector. And joining me to have this very important conversation is the principal of Mwiki Goodhope Academy, Mr. Fredrick Muingi. Thank you so much, sir, for creating time for us.
Thank you, Madam Serfine. My name is Fredrick Mwiki, as you've just stated, the principal of the MGA schools. MGA school stands for, Mwiki Goodhope Academy. However, because of the fact that we've started to expand our scope and reach several other estates now, we thought it would not be good for us to really call our school Mwiki, because the initial campus or the main campus is in Mwiki. So that's why we came up with the initials MGA schools.
MGA schools.
Yeah, so we are running 3 campuses as we talk. The main campus, as I've said, is in Mwiki. The second campus is in Kasarani, called MGA School Kasarani, and now we have the newest campus, which is MGA School Kamulu.
All right. Yeah. I know it is such a busy time for you.
Sure.
Right now, our schools reopen. There's just so much that has to be in place, and you being, in charge of that particular school, there's a lot on your desk right now. Sure. You will be sharing with us some of the challenges you have faced. But we also like to invite you to be part of this particular program. At KBC Channel 1 is where you can interact with us on social media. We are streaming this live for you, so follow this program in case you cannot be able to stay on in front of your TV set. Plus, we also invite your comments, so do share with us your thoughts with regards to the conversation we are having in studio on that particular platform, or you can choose to communicate with me directly on my social media platform at Serfine_Achieng on Twitter, on Facebook. Talk to me at Serfine Achieng. Thank you so much for creating time for us once again. So, Mr. Fredrick, let's begin straight away with this conversation. Yes. Day 3. For a very long time after the country reported its first COVID-19 case and schools were closed, there was a lot of uncertainty about when learners will go back to school and whether it was even right for us to be having that conversation. We allowed grade 4 learners to go back and the candidates to go back. Now it's almost, quite a number of learners going back to their, resume their physical classes. Day 3, after having seen what has happened, does it give you the confidence that we are actually moving towards the right direction as a country?
All right. Thank you for the question. Let me say that from the time we first got the first case of COVID-19 announced in Kenya, we all did not know what we were getting ourselves into, especially when the president announced that the schools were to be closed. But, okay, some of us thought we would just close the school for a week or 2 or a month, and then we'll be back. So we did not foresee that it was going to be such a long period of time. However, in between, a lot happened. The children stayed at home for more than, I think, almost 10 months or 8 months. Teachers were sent out of school, some of them not paid. Some schools tried online learning and so on and so forth. And then it came the time that now the president, or through the Minister of Education, now thought it was good for us to start the phased reopening of the school. And we were told now the grade 4 and the standard 8 were the first ones to come. We did not also think at that time it was right, because you remember the numbers of the people being, identified as being infected with the COVID-19 were still very high, and there was a lot of scare. We were a bit scared because we did not know whether, when we open this and the children come to the learning institutions, that was going to be like an environment, for the spread. And therefore, we said, okay, because we need to have the children in school, given the things that were happening, let's have them, and then we see what happens.
So do you think it was about time?
It was the best time because with the 2 classes we were able to do a bit of experimenting. We were able to see our preparedness. We were able to see whether the preparedness we had put in place is able to support the children and be able even to ensure there's no much spread of the virus in schools. And I think from the information we've got is that, you know, there was minimal spread of the virus in schools. There was, yes, some principals passed on, some children and so on and so on, but it's not as much as we thought it would be. So with that...
So you're saying the first reopening, the initial, you know, stage of this whole process provided opportunities for us to prepare
for us to be
the
able
bigger...
Yes, for us to be able to, you know, because before the grade 4s and the standard 8s came, the schools had to put in a bit of measures, you know. We had to ensure that there is signages in the school to ensure that children are well directed as they walk along the corridors. They know that they need to keep a distance from one another. They know how they are supposed to you know, they're supposed to keep washing their hands and so on and so forth. We were also supposed to ensure that our classes are set in a manner that the children are not sitting close to each other. You know, we were able to put all those measures in place. So it was time for us to have a few students in the school to just see whether the measures we put in place are actually doable, whether we're able to sustain them, and whether actually they're effective in ensuring that we do not have
the spread.
Yes.
Yeah, and I'll be talking about those measures in just a bit, even as we pick up this conversation to see what, you know, probably as one of the stakeholders in the sector, you have done yourself in your institution to safeguard the safety of learners. But I'd also just like to remind our viewers to be part of this conversation. Plus, you can also tell us whether you feel the time was right but to reopen schools. Do you think the country had done enough for us to ensure the safety of learners as they go back to school? What do you think? You're a parent, probably you're a student or a caregiver. What do you think? There's a school next to you or a school your child is attending. What concerns do you have? Share with us those thoughts as we continue with this particular conversation at Serfine_Achieng on Twitter, Serfine Achieng on Facebook, and of course at KBC Channel 1. That is our official handles on social media. We will share some of the views as they come forth in the course of this particular conversation. We are doing this together with Lucy Mwaura, our sign language interpreter, and of course we invite you to continue interacting with us. For now, I will now just take you through some of the safety protocols that were issued by the government through the Ministry of Education for all schools to put in place. And this include a provision of hand washing points with water and soap. Enough hand washing points that can cater for the population that the school has. And of course also schools were required to restrict movement in and out of the institution. For visitors, for learners, movement was actually there was a directive that movement should be restricted. And of course making sure that there is mandatory temperature checks at the points of entrance. So everybody, including the learners, the staff, the teachers there, should undergo a mandatory temperature check. And of course the issue of maintaining social distance, and this required actually all schools to ensure that desks be put 1 meter apart so that every learner is away from the other by just a distance of 1 meter. And of course schools were required to also create isolation facilities in the event that there is a suspected case of COVID-19. You know, that learner or that staff member can be taken there as measures are put in place to transfer them elsewhere. And of course we saw also a directive being issued to ban co-curricular activities, sports, drama, all those activities that learners usually engage in outside their classwork were banned. And of course also things like assemblies and parents meetings also, you know, there's a lot of they're going to be banned going forward just to avoid the crowding. And of course school buses are required going forward to carry half their capacity. Schools are also advised to serve meals in shifts so that in case you have a large number of learners, you can be able to organize how they're going to be, you know, getting their meals. And of course, wearing of face masks at all time in the right way, not on the chin, but in the right way at all time by everybody. I had something to the effect that learners with disability are going to be allowed to wear transparent face masks so that it doesn't interfere with their means of communication. And of course, provision of hand washing points. I took you through that. And schools that are facing shortage shortage of water, it's reality, we know that, are advised to invest in enough hand sanitizers. And I can go on and on. It's quite a number of directives that were issued just to avert the spread of COVID-19 during this particular time. So back to you, Fredrick. Yes. And I know you know this better than I do, because you're part of those who are actually required to put this in place. You said, the phase reopening provided us an opportunity to learn and to see whether some of the measures that had been put in place were effective enough. I've just read the list of some of these measures. Right now, as you look at the schools and what they've been able to do, even what you've seen from other parts of the country, do you think all these requirements have been put in place to a satisfactory level? Can we say that now we are set, we are good to go? Yeah, so let me pick it from where you've just left and say that the Ministry of Education was actually, in collaboration with the Ministry of Health, was able to produce a document that detailed exactly what needed to be done. And I think you've highlighted the major areas that were of concern. And as you ask, whether we can say we have satisfactorily equipped the school and with all that, I can say yes. However, satisfactorily yes, but I can't say it's up to 100%. I must say, to an extent, schools have tried. Of course, depending on school, it's case by case, because schools have been affected differently. There's a very big challenge that is facing schools as we talk. Government schools, you've heard the minister say that they are going to release capitation funds. I think they said this week that money was to be released so that the schools can be able now to put up these measures, especially the issue of hand sanitizers in the areas where water is scarce and such. But I want you to look at the case of a private school that is not receiving any capitation from the government. And that school is required to dig deeper from their pockets and be able to, put up those measures as you have detailed them, from the hand sanitizers to hand washing points to 1 meter apart, increasing number of desks, and that means increasing number of classroom and so on and so forth, because you can have a desk but the child cannot be able to learn outside in the sun. If you increase the desk, it means you're increasing you're increasing the space, and the increased space means you are putting up new buildings. Because again, in a private, you don't expect a child in a private school to go under a tree, as we have seen in social media. Some students are learning under trees. Such will beat logic why a school is called a private school. So it's very hectic and heavy for a private school to be able to put up these measures, and especially schools that were not well prepared or were not ready in terms of keeping aside some funds to facilitate this. So I can say, yes, to a great extent, some private schools have been able to satisfactorily put up the measures, but I must also say there are many schools that are really lagging behind. But that said, students are still in school. Students are in school and they are learning. So the thing is, what the emphasis you can give the government is that there needs to be a proper inspection of schools through the maybe sub-county directorate of education, to ensure that schools that are not compliant probably are assisted in a way, probably to catch up with the basics. They may not put up everything, but the basics, especially the mask. Every child has a mask. They have hand washing points, because that's something that can be availed. If not, then the hand sanitizers you get. Because if that does not happen, that it means that there are students that are going to be at a very high risk of contracting COVID-19. And that is something we do not want to happen, because you can imagine how many families will be affected in the event that the numbers of COVID-19 rise in the learning institutions.
That if one child in a school, and some of these schools, because they are in the interior estates, where even the Directorate of Education I'm talking about does not even reach, because maybe the roads are not even passable. So these people will manage a situation, and you find that they have crowded classes, pupils are not washing hands, they have no masks, and they are risking, or they are putting everybody else in the society at risk.
Which I just want to understand what, as a head teacher of a school, what has been your bare minimum? What is it that you have done in your school to adjust to this new normal?
Okay, what we've done so far, we've done quite a lot, by the way, as a school, because probably by matter of being privileged, we were not found just like that. At least from the time schools closed, we were careful enough to know that there's a time coming that will be required to open. So the school management was able to put aside some funds just for the sake of the preparation to the reopening of schools. So when we have been told to reopen, or when we were told to reopen for grade 4 and standard 8, as I said, we were able to put up enough signages in the whole school compound. So children, as they walk along the corridors and in their classrooms, they are directed. They know that in every step they walk, or in every part they go, they are being reminded that you need to wash your hands. They are being reminded that you need to have your mask on properly. They are being reminded that you need to keep a distance from your friend. So the signages in the school are adequate, and we can and they are well they are conspicuous, such that as you walk you can be able to tell you are well directed. Then the other thing we've done also is to put up enough hand washing points. The capacity is one hand washing point is to at least 30 students. So we've been able to install them at the entrance of the school and also at every corridor of the school, because now children will be leaving class, going to the toilets, coming back, they need to wash their hands, they need to just get to the practice of washing hands as often as possible. It doesn't matter whether you think you have to touched anything that is, yes, or a floor that is dusty or something. Just we want them to get to the practice of washing hands as often as possible. So that one I can say we've got right. Then we've provided also hand sanitizers, and these ones we provided in the classrooms, so that every class we have the hand sanitizer, which will be used occasionally, not all the time, because they are also not cheap. So those ones we are not going to be using them as, the hand washing is what is going to be the main thing, because again we are privileged to have our borehole in the school, which provides water, enough water for everything. So the other thing is thermogans that we've invested in to ensure that the temperature of every visitor in the school is being checked as they come in and recorded. The students the same. Those that are in boarding, because we have a boarding section in our main campus, when they wake up, before they go for their meals, the temperature is taken. At lunch hour, their temperature is taken. In the evening, their temperature is taken, and all this is recorded, so that we have clean records that are showing how a child's temperature is behaving, because we have said that one whose temperature goes beyond that 7.5, then that person needs to be removed from the rest of the crowd, and they probably given some time to relax, probably you take it again. If it is still high, then the isolation room, the isolation room, we have an isolation room, yes, and we have a school nurse who is managing the isolation room with basic medical equipment. So that's where we'll take this person, and immediately the parent is informed, so that they can also be, because a temperature of that 7.5 does not mean that somebody has COVID-19. It could be anything. It could be anything. So that's why we call the parent. But if they, display symptoms as those of COVID-19, then the measures are taken a bit more seriously.
So take me through this. Have you done something to the effect of training the teachers to be able to be on the lookout for such, like you're mentioning this morning?
When before the standard 4 that the grade 8 came, we had to bring all the teachers to school. And the document that has been given by the ministry is quite elaborate. So we went through it point by point, so that everybody who handles the children understands what is expected, including the cleaners, including the cooks, everybody. So we were able to take them through for 3 days. We were able to sit down and talk about COVID-19 management. We were able to go to the gate and have a training with the security guards that manage our gates, so that they know that not all visitors are allowed in the school. In fact, in our school, any visitor to be allowed in, they must have an appointment, which is very clear. So when the guards are aware of that, so we are turning away people because we do not want somebody to come out there and then come in the school and they are carrying this virus, and then we find ourselves in a situation. So a lot of training has happened, and we are not saying that is enough. Training cannot be enough. So we are still taking, today is when the students are resuming back, because we needed to have like 2 days to, finalize or to do the final touches. But for the 2 days that we have been in school, Monday and Tuesday, again, a lot of training has happened to all the staff. So training is the main thing. As the children come...
Probably, as we just take this generally, what is the significance of ensuring that the teachers and the staff handling the children and those who are sort of having a responsibility in the school are well trained to manage COVID-19? What impact will this have?
I think it has a very, very major impact, or it is quite significant, because these are the people that are going to be the children, isn't it? So if they are not aware of, for example, the COVID-19 symptoms, you see, somebody may start panting, or a child may start panting, and then they are there thinking that could be, it is asthma or something like that. So they need to be able to see a person and be able to tell this one, the symptoms they are displaying are similar to those of the disease that we know. These people are the ones that are going to be cooking for the children. So we don't want them to prepare food and cook and serve it in a manner that would, again, compromise the safety of the children. So I think the training of the staff and giving them the information and empowering them and giving them the safety gadgets, like for example the headgears and for example in case of the cleaners, they have the hand gloves and the gumboots, and giving them this in the kitchen also ensuring that they have the protective gear. I think to me that's more important, because when the children come, or when the children are in class, it is these people that will guide the children. Remember, these children are coming from home. At home, there was no much emphasis on COVID-19 measures, because parents feel, I'm at home. These are my children, I'm safe. My children are safe so long as I'm safe. I take care of myself out there, but when I come at home, I believe because I feel I'm safe, my children are safe. Then you understand also at home it's difficult to keep social distance, it's difficult to... So they are coming from a totally different environment where these things were not emphasized. So the children will require to be taken through an orientation of how they can keep themselves safe. Who will do that? It is the teachers. The teachers will not be able to effectively do it if they have not also been empowered. Remember, they have also been out there. So what I'm trying to say is that the training and the empowerment of the staff of the school to us is the key. And again, I want you to also know that this is not something we have started because of COVID-19. As a school, we believe that when the teacher or the staff member of the school is empowered, then they are able to guide the children in the proper way. And it is said that children will not even learn what you teach them. Most of the time they catch what they see in you. So if you have a staff member who is not well empowered or well cultured, they may pass the wrong values. So our training in the school is quite elaborate. We say that in a term, every staff member must go through a cycle of training where we touch on 3 areas. We touch on the personal aspect of a person. So we train you on your personal life. We want to train you on your relationships. Are you able to form proper relationships? Are you able to manage your finances properly? Are you able, on a personal note? Then we also train on professional. So we build their capacity to deliver results. And then the third aspect of our training is on leadership and also now the school culture, understanding how the school works, what is the culture of the school, what is the vision of the school, where are we headed to. So before a term ends, we have to ensure that.
Okay.
Yeah. Then
Good.
Before I finished on this, I also wanted to say that we have also set up what we call a safety and health committee in the school, in every one of our campuses, that every day they are sitting to look at what are the risk areas, what are the risk items in the school that would compromise the health of our children. And then they are advising the school management, let us implement this, let us put up this, let us change here, so that we can ensure that we have a safe and a healthy environment for our children. Yeah.
It's good that you brought that up, because one of the issues I wanted to address in this conversation is how much schools have invested in the health system. You know, it's about learning, it's about classwork, but are we looking at the health of these children? Do we have nurses? Even how many schools have nurses that can actually just you know, help them in that part? We'll talk about the importance of that later on. But I also want to understand, there are quite a number of schools right now that are complaining of having a challenge in implementing the social distancing directive. I don't know what options probably you can share concerning how this can be attained, because we have to face our reality. We have overcrowded schools that have enrolled so many learners. How do we then make this you know, work for such environments?
The truth of the matter is that we have a lot of crowded schools. Remember, we are having academies, private schools that have closed down. Many of them actually have closed down because they were not able to survive this period. And therefore, the students that were attending school in this particular school that are closed have to get a school to go. And which are these schools? There are schools that have opened like ours and the other school and maybe the public schools which are have already been full. So the social distancing aspect of the preparation for the preparation for students is one of the biggest challenges and nightmares that schools are facing. And as you say, we must face the reality. It may not be possible, as I sit here, I cannot lie that it's going to be possible for a school to have 1 meter distance from one student to the other. Because why? If that happens and the school does not increase its infrastructure as far as classrooms and other, you know, increase of classroom means increase of staff, increase of... So if the school is not able to increase its staff, increase classrooms, which is almost impossible for now, given the situation we are coming from, then it will be a lie for us to say we will be able to keep a learner 1 meter from the other. That means that if we are to achieve that, then we have to lock out a few students, other learners.
So you're saying it's not practical to achieve social distancing in our schools?
Entirely in the whole school is not practical. Probably you can do it in a few sections, probably, depending on how your school how your school's growth of students is. But basically, it is going to be a big challenge. So what we have done for us as a school, we've said that we will ensure that the learners are not congested. So we are not talking about 1 meter, but we are saying that we are going to avoid what? Congestion in classes or in every activity, such that there's a distance between one learner to the other, and learners know very well they are not supposed to be very close to each other. However, not necessarily 1 meter from one learner to the other. Then the other thing we are going to do is again to emphasize to the children that there's no touching each other, there's no greeting each other using your hands, there's no hugging the school. You know, every time wherever you are, ensure that you are away from if you can be able to keep a 1 meter is okay, but you must not be very close to your friend. As you walk, as you get to the classroom, always ensure that there's a distance between you and your friend. I think that is basically what we are going to do. But
it's not possible?
It is not possible, both in the private and in the
social distancing.
Yeah, but the other thing is also, you see, this virus is transmitted because of droplets, as you talk or even as you sneeze and such. So if we can ensure that children that are unwell, because that's another policy that we have, that if you're a child, and we have told the parents, if your child shows any symptoms of being unwell, do not allow them to come to school. They should just stay at home until they recover from whatever illness, and then you can now bring them back. So if we ensure that that happens, and then in the classroom, we are advising teachers to ensure that the classes are arranged such a way that all learners are facing same direction. You see, sometimes teachers want to make these creative arrangements whereby learners, group discussion, they are facing each other and such. We have said that has to stop. All learners should have their one locker, and they should be facing the front of the class, and the teacher should be in front. Then the teacher will now wear in addition to the face mask, they will also wear the face shield, so that, because it's the teacher in the classroom who talks a lot throughout, and sometimes because they want to emphasize and hammer these points, they sometimes raise their voices, and you find this droplet can easily go to a child. So we have said that we are going to ensure the teachers are on their face shields all the time, just to ensure, because the children, rarely do children shout in class. Because in private schools, we manage the children properly. There is always a teacher in class, so rarely will children really talk unnecessarily or talk so loudly. So if they are facing the front and the teacher is on a face shield, it will be difficult for really this. It can happen, but we have reduced the chances.
The chances of that happening.
Yeah.
All right. You know, it's good that you're painting a picture that it's not all doom and gloom. Even as schools reopen, there may be concerns that our state of preparedness is a bit wanting, but it's not all bad. There are the things that schools have done, and there are other opportunities schools can tap into,
of course,
to ensure that they adhere to the guidelines.
You know, what I can say is, and for the parent who are watching here and every stakeholder in education sector, it is good that we are opening school. That's what I can say. It is good that we are opening, whether there is social distance or not. Because these learners, when they were at home, what have we seen them doing? They have been playing in the estates, isn't it, with their friends. By the way, rarely have I found children play with their friends from the other plots and so on in their face masks. So they are always just they care less. And the parents also care less, because they leave them, they go to work. The children get out, and you can find almost a school in the streets. And they are just playing together. Then what has happened? The children have been able to teach each other, you know, bad manners. In some cases, we've seen a lot of vices with our children. You saw the cases that were happening when children were just appearing from home and they are found in houses, in places,
and the rise in the cases of teenage
pregnancies. You get, so it is far much better
for them to be
in school.
All right, has this come with challenges implementing these directives? Like for some schools that opened on Monday, for you say you're allowed.
We've taken a few days.
Yeah, has it been easy though?
I can't cheat you that it has been easy. It has been not easy. Remember, we are being meant to put all these measures with limited, or at a time when we are facing financial constraints as a school. So sometimes you have to really budget. And you know what has happened is that some of the schools that we can say have got this right, or are trying to get it right, are schools that probably were able to sacrifice a few other things such that they can be able to spare some finances to put up these measures. It meant that that probably things they were supposed to do, like even maybe paying their teachers over the time the children are not at school, they did do that, because a director who is visionary thought, if I use whatever I had and give it to the teachers, some schools would have supported their staff for the entire period. But then would you consume everything that you had just to pay the teachers and forget that there are times that's coming for? So there was a sacrifice that had to be made for these measures to be put in place. And therefore, it is not something you can say it was easy. It was difficult, including, you know, sourcing for the materials and everything, because it means that some staff also had to be now brought back to the school so they can be able to run up and about, trying to look for these signages, look for these hand washing facilities and everything. So it has not been easy. And as we do that, we're also doing it not knowing, like when we started ourselves, we didn't know when the schools were going to open, because there was that
uncertain.
The minister comes and says we are opening, I don't know when. Then again, now we can't open. So we invest us up to some point. We are told there's no opening. Then we look at ourselves. We ask ourselves that we have already spent this money. We would have used it for something else. So it was a bit hectic, but we thank God for where we are. At least we have the basics, and we are sure that whatever we put in place will be able to curb this spread.
In this conversation, you have kept on referring to how the private schools were affected and became financially crippled. Probably you can talk to us more about that. How bad was the situation? Like right now, what are some of the consequences that some of these schools will have to face for a very long time before they bounce back to normal?
Yeah, the consequences of the break that we found ourselves in after the first case was reported and the president announced the closure of schools is immense. First of all, to the staff. Let me say the staff were hard hit by this. Schools, immediately the closure was announced, were able to support, many of them were able to support their teachers for one month. And after that, all the staff members were probably given letters for unpaid, to proceed to unpaid leaves. Now, what that meant is that these people, needed to feed. Some of them have families in Nairobi or wherever they stay. They need to feed their families. They need to have their lives going on. So what do? They will not sit there and wait. Let's wait until when the minister will announce the schools are resuming. So they venture into different other things. And it has been very difficult, even as we talk now, to get some of the teachers out of their, whatever it is that they went to do. Some of them went to do some businesses. Some of them got into different other employments. And some teachers and the staff members of some schools have stopped or have decided to quit the profession.
The teaching profession.
The teaching profession, given that it you know, to the government, it was not, the government did not support schools. You know, we saw a lot of, you know, the government supporting different organizations, different institutions, hospitality, hotel industries, and so on, were given money to support their employees. But what happened, we heard of some promise of some, I think, 7 billion that would go to private schools to cushion the staff, but that was never to come. So what happened, schools could not be able to support. These staff members now are out there. So schools now, as we reopened, even from our case, we have spent quite a lot of time from, even during the Christmas time, just to interview, to train, to orient new staff members, because besides even the aspect of some of them not turning back that we used to have, there's also the aspect of the increase in staff that we want to help in as we distribute the learners into various classes. So that's a big impact to the private sector, that there was lack of finances, and therefore the support of staff members was not there, and therefore majority of them left the profession, meaning that the schools now are struggling to put up a new staff, which, you know, for you to build a capacity amongst your staff, you have to invest a lot of training, a lot of time, and so on and so forth. So that, to me, happens to be the biggest impact. But again, also, the fact that the learners stayed at home for all this time, and you know, the reason why parents choose to take their children to private schools is because they know in private school the children will be taught in the right way, and they will be taught and pass, you know, get good marks and maybe proceed to good high schools.
But we have also public schools that have produced
but majority of
progress
them,
well.
When you look at the analysis, when we do maybe, for example, a KCP examination, and you look at the analysis of performance, you realize that majority of the schools that do well, majority of them. In fact, in the list I looked at the Nairobi County performance of last year, and I think the first public school was around number 15 in the entire county. That's to mean that many of the parents are looking at quality education, and that's why they would choose to sacrifice a little bit more and be able to take their children to the private sector.
And now that you've brought that debate, how do you describe the relationship between public and private schools? What is being done different that is working for your sector, probably?
You know, for us, as I've just said, we understand that as much as we are an education institution just like the other public school, we are also a private entity which is also in business. And therefore, we look at what would attract a customer. And the customer, in this case, I'm talking about the parent. What will a parent look at for them to choose to come to a school and not go to the public or the other school? And when we look at that, then we say, one, they want a place that offers safety for their children. So we go in there and ensure that safety is assured. From the time the child enters the gate of our school, the management of that child is in such a manner that assures that that child will be safe throughout the day up to the end. In fact, one of the things we've done is that we've ensured there's no activity. In the way you tell children, go and play, it's break time, it's lunch time. In our school, there's nothing like that. Every activity of the children has to be supervised by a teacher. So the children, as they go to the toilet, especially the young ones, a teacher is with them. As they go to the field, a teacher is with them. Why? Just to ensure that we offer that what the customer expects of us. The other thing is performance. They want the child to do well because they are actually paying money to support that. So what do? We ensure that the teacher that we put in the classroom is very, very well trained, qualified and well trained. We ensure that we have failed the necessary resources that the teacher will need for them to be able to course performance. We ensure that we reward the teacher, pay the teacher in a manner that will motivate them to do well. We ensure that we also measure and monitor what is up in the classroom. That means that many times we allocate the duty and then we are supervising what is happening. We are going down the class, we are checking the children books, we are checking. So there's a lot of work that happens in the private school just to ensure that the school sets itself or differentiates itself in the marketplace. Yeah, so which you'll not find in the public, because in the public, the teacher's salary is coming from the government. So these people may not have a lot of zeal to cause this performance or to ensure the children are safe. In fact, I see many of the children, how they are treated in the public school, I say, and also because I went to a public school, so I know what happens.
I was about to ask you, you're a product of a private school.
Yes, no, I'm a product of the public school. So when I try to look back at what was happening to us and what I see also happening currently, I say then God's grace is sufficient. And because when you look at what happens, sometimes the children can easily get themselves into very serious issues like injuries and so on and so forth. So private schools have set themselves apart, and that's why the performance from them is different, and that's why a parent would choose to come to a private school as opposed to the public, and even pay, because public schools is free, isn't it? But like a school like ours, we will charge a parent maybe an average of around 30,000 per term. So you see, a parent will decide, let me not make child to a school that is not charging anything. Let me take to a school that's charging around 30,000. That's what they expect.
All right. Talking about parents, right now there is the school fee headache. Yes, schools have reopened, and parents have been actually directed to take their children back to school. Yeah. And it's not going to be business as usual, including learners who probably became pregnant during the COVID-19 season. Every child, actually, according to the Ministry of Education, is expected to go back to school. And I think maybe punitive measures will be taken against those who will not adhere to this directive. But, there is that other dilemma. Parents are facing a lot of challenges when it comes to, just being able to afford to take their children back to school. I don't know what can be done to ensure that schools balance this dilemma, because yes, the Ministry of Education has affirmed that all learners need to be in school, and they're not supposed to be sent back because of school arrears. But schools have also been financially crippled over the long COVID-19 season. They need money, and they need it now, so that they put in place some of these safety protocols. How do we balance this?
There's actually, and I like the way you put it at first, which is something that I did not, weigh in on the relationship between the government and the private sector. And I must say that the government, our schools, all schools are controlled by the Ministry of Education. So our directive, whatever how we do our things in the school, we have to get direction from the Ministry of Education. But where I find a conflict as a person, I'm not speaking now as a person, is where we'll be given directive by the Ministry of Education, but the Ministry of Education will distance itself with the private sector at times of calamities like what we found ourselves in. But then when we open school, they will tell us, take all the children, do not send anyone away. They all have a right to education, which is true. So at that point, if I was to advise the government, I would say that if there is capitation, for example, what we are having now, as I come to what you asked, if there is capitation that is happening to public schools, can we consider also the private schools and be able to also, at least at times like now, when we know they are very much affected, can we also consider them for some bit of grants so that they can be able to revive and be able to move on? Can we, or else, can we allow the private schools to just actually operate as separate identities where you organize yourself, so provided the curriculum is the same from the KICD? That's something I think that needs to be followed up, because I see it beats logic that they want to direct us on what to do, but at the same time, the internal issues that we are facing, you are far from them.
But then how are you dealing with this, though? Because it is a directive, and a directive is a directive.
For us, we understand and we are cognizant of the fact that many parents are affected by the COVID-19. As much as the school, we feel the impact, but also the parents, some of them have been heavily affected. There are parents that have lost their jobs. There are parents that stopped their businesses because it was difficult for them to continue. And what that meant is that, or what that means is that the parents will struggle actually to pay the school for their children. But for us as a school, we have decided to consider our parents case per case, because these parents are affected differently. And what we've told the parents is that your child is welcome to come and learn. However, we will need to hear your story. We need to hear that I've not paid my school fees. The reason why I've not paid is because my business was affected by COVID-19, but I'm doing 1, 2, 3, and by this time, I hope that I'll be able to pay the fees. With that, say to us.
So you deal with it on a case-by-case basis?
Case-by-case, because there are parents that have not been affected. If there are parents, actually, as we talk, whose businesses actually have done better, because maybe if you are selling hand sanitizers, for example, so you're doing well. Yeah. You're doing better than you used to do before COVID-19. There are people whose lives have been uplifted by this pandemic. That's the truth. So if we say, okay, we are reducing school fees for everybody, you see, so there are some people that actually would have paid the school fees. So we are saying this, pay school fees. We have given the invoices, pay school fees. So you can pay. If you can't pay, we tell you, come to the office. So you sit with the head of school or the administrator of the school, and you will be able to give your story. Probably it will be recorded somewhere as a commitment that you are making. Then we allow your child to get to school. Then what we are going to follow is actually the commitment that you're putting. We walk the journey together. That's what I'm trying to say. And then in case of parents, because we also have a program for you know, taking care of children that are most heavily affected or that are most unfortunate in life. If there's a parent who has, you know, a deserving parent, maybe they cannot be able to afford. Those cases are also considered by our director, and she grants actually bursaries or what we call sponsorship for such cases. So far,
I know you just reopened today, but how then do you plan on you know, tracking in case there are some learners who will not report back to school after the days that you've set probably as a deadline for coming back or anything? Yeah,
it's true. Today we have the borders coming back, and tomorrow we are having now the entire school. Those that are day scholars now joining in. So tomorrow is Thursday, we give them again Friday, because there are those parents that are also taking time to prepare.
Last minute preparations.
Yes, but starting Monday, we are going to be getting reports now. The reports are coming from the class teachers telling us, when I closed the school in first term, I had these students. After now we have opened, these are the students that I have. Maybe the new ones are these ones, but this number has not come back. So what we do in that case, we call the parents. And that is not, we are not doing it this time. That's what our practice. We call the parent and ask the parent, okay, we have noted that your child in the past 2 days since we opened has not come to school. So what could be the matter? What could be keeping you? They tell us, oh, I didn't get school fees, this happened. We tell them, why can't you come to the school? So some will come. Another one will tell me, now I relocated from Nairobi, now I am in Murang'a. Then we tell them, so has your child gone to school? So they tell us, no, I'm still doing one, to keep us posted in case of anything. So the thing is, we have to track all our learners all the time. We have to ensure that each one of the children that we had before are actually in school, either in our school or they be taken to another school. That is what we do. Yeah.
Thank you so much for you know, just telling us that, because it would be interesting to know, you know, how then can schools track
however, before I leave at that point, there's also something else that we are doing, because we have also realized there are parents that are very apprehensive about what is happening, and they think it's not the right time
to reopen school. Allow me pick up that in the next part of this conversation. But right now, we are going to be taking you to the coastal region. Michael Mwandiga has been following up on the strike by nurses, and I understand this particular morning there is a press by the KMPDU he has been following up on. Let's just listen into what he has to say. A very good morning, Michael. Kindly just tell us, what is the status of you know, the plight of the healthcare workers in the coastal region today?
Well, good morning to you, Serfine. We are coming to you live. Good morning to you, Serfine. We are coming to you live from Mombasa County. We are at Coast General Teaching and Referral Hospital. We are meeting the doctors from Mombasa County. They have been on strike since 2nd of December last year, and their grievances have not been addressed by the county government of Mombasa. And I'm hereby joined by the Secretary General of the doctors in Mombasa County, who will tell us what is happening. They have been served with disciplinary letters pending to which they'll be sacked just if things don't go well. And I'm hereby joined by the Secretary General, who will put into perspective what is really happening in Mombasa County on health matters. Karibu Daktari, what is happening? You have been served with disciplinary letters. What's going on?
Maybe we jog back a little bit.
Yes.
Doctors in Mombasa went on strike on the 2nd of December based on certain grievances that even engaging the county for the whole entire year of 2020. And we had reached an agreement, then they defaulted again on that agreement. Top on the list is that Mombasa County deducts these emoluments of statutory deductions and third-party deductions from our members' salaries, and it does not remit it to the banks. So when this has accumulated in arrears, what that means is that our members now have been blacklisted in the CRB. That's number one. Number two, they cannot access any loans because of that. Number three is that whatever little salary that eventually gets into your account, though all the time it's late, it is deducted, all of it. So when you say that our members don't have salaries, it is from that perspective. It has to be understood from that perspective. Again, I mentioned about an agreement that we had. They signed without anybody putting a gun on anyone's head, and we signed an agreement on the 2nd of October. And virtue of that agreement, we kept our part of the bargain, and they've refused to keep theirs. What was in that document involved job progression for doctors who have stagnated for 5 years, some 6 years, some even 10 years on the same job group despite advancing themselves in learning. I mean, fair labor practices compel that we follow schemes of service that doctors came with from the national government. You can compare same doctor with the same qualifications in this county will be at a lower job group compared to a similar doctor in neighboring counties. I mean, those are issues that are just clear, black and white, out there in the open. We don't even need to be tussled and haggle about such kind of things.
So, what is the situation so far at the hospitals here in Mombasa, the public hospitals?
First of all, I'll start not by describing the sorry state, but by advising members of the public that in case you fall sick, please just visit Mariakani. Is not too far away. It's 30 minutes away. Or Kilifi is not also too far away. And if you need public services, health services in the public sector, those are the corners to take. Yeah. But all the doctors, all the nurses, all the clinical officers, all the laboratory workers, you see, all these people are saying the same thing. They're accusing Mombasa County of the same thing. They can't all be wrong. Yes, they're all out, so there's no service, unfortunately.
So matters as they are right now. So it is here at Coast General Hospital, which is just right behind us. So it's only the emergency which is working, but everything has been paralyzed on matters of...
There are no emergency services. Just one or two trainee doctors who are purporting to see patients at the... It's called the outpatient department, not emergency services. Yes.
So far. Well, thank you so much, Serfine. It is how things are here at Coast General Teaching and Referral Hospital in Mombasa. The doctors are complaining. They are complaining to county government of Mombasa for not meeting their demands. They had stated their grievances earlier before, and as he had put it, Dr. Mwache, is that they had signed an agreement back in October, but it was never implemented by the county government of Mombasa, despite them, by the virtue of being they implemented their part, but the county government rather didn't do their part. So since December last year to date, this is 1 month and some 5 days so far. They have been on strike, and the services are paralyzed at the Coast General Teaching and Referral Hospital. And as he had put it, for those who are sick, they should be visiting Mariakani or Kilifi County. It is really sad state of affairs. The things they have said, it's also the statutory deductions which are never remitted, with some of them being blacklisted in CRB. So it is how things are here in Mombasa County. Of course, we'll give you up-to-date information as events unfold here in Mombasa. And from Mombasa County, back to you, Serfine Achieng in Nairobi.
Particular update. Michael has really been following up on some of the issues that have been raised by the healthcare workers in the coastal region for a better part of this week. Yesterday, he was following up on the strike by the nurses and talking to nurses in the region. Today, he has been at the Coast General Referral Hospital talking to doctors who have been on strike since the 2nd of December last year, and they say that there are quite a number of issues that they have raised with the county government. They even signed an agreement in October, an agreement that, according to the doctors, has not been honored, and this has prompted them to take industrial action. And of course, services have been paralyzed at different health facilities, like Michael is telling us, and of course we'll be giving you more details about how this is going to pan out in the coastal region. We have been talking about matters education in studio. We are going to be picking up that conversation when we come back from this particular break. Do stay with us. This is News Check.
The magic of FA Cup is back with mouth-watering ties as the Premier League and Championship clubs enter the competition in the third round. KBC Channel 1 will ensure you don't miss out, live and exclusive on your True Sports partner from the 8th to 11th of January 2021 as we kickstart the new year with you in mind. Save the dates for the best and route to the finals. Tonight on KBC Channel 1.
See, selfishness is mean and destructive. Yours is for the greater good. And think of the boxers. How much good this gym brings into their life.
Do you really want to take on Abasi again? You know what he's capable of.
Basi won't let this one go. People will get hurt. Do you want that on your head?
Those children, lazima wapigane kwa nguvu. They cannot let that man win.
You are going to deny me what is mine again.
He's manipulating me and you. He knew you'd come to me.
You're telling me to step back for Julia and Manjala like you always do.
Next on.
I would like you to conceptualize the campaign launch of a new coffee product and base it on the concept that I call 3-in-1.
I don't think we should get married.
What?
There's another woman in my life.
That she got into an accident on the day that she tried to abandon her husband in order to flee with.
With who, Mrs. Cello? With whom was she fleeing?
My love, I haven't heard from you in a long time. I see that your son still remembers who I am.
Two lionesses struggle to cohabit.
Because I'm not going to stand here and be compared to some...
Hey, Nancy, don't try me.
As the coastal vacation brings Nancy and Joe closer.
Nancy, you are full of surprises. What would you like me to do for you this morning?
Or will it be?
Now, can you give us some space? No.
He? Ni usherati.
Watch your mouth, Mother Teresa.
Or what?
This game that you and Nancy are playing.
Na nyinyi mmekuwa akina nani kuingilia mambo ya wazazi wenu?
Stringed, making a comeback. Hotter.
You're just gonna stand there and stare at us?
How do you think things will end up here?
This is a conversation between your father and I.
Sometimes it would be good if you would just stand your ground.
Wewe mtoto, wewe. What happens between me And Mama Paul is none of your business.
You know Mama Paul is leaving you.
So what?
What? I'm done being your puppet and dancing to your tune and manipulation.
I called the clients and told them that the court has shut us down.
Only on KBC Channel 1, Fridays at 8:30 p.m. This weekend on KBC Channel 1.
Remember, it was my idea to begin with, and there is no group. It is just me and you.
You have to skip to my room if you want me to cooperate, okay? There is no man in this world who likes to be around like a chicken.
Yeah, what do you do? Why don't you put your feelings in check? What is your problem? What do you want?
And what about the video Atido was showing you?
What video?
Yes, what video? Hey, teacher, don't mind her. She forgot to take her medication in the morning.
Well, that better be the truth. Bunch of idiots.
Did you just call us idiots?
I'm sorry, that came out wrong.
You see, this thing happened. Slippery cat.
Maybe they don't have money. Maybe we should just stick with the original plan.
Classmates, every Saturday on KBC.
Welcome back, and thank you so much for staying with us. And in case you're just joining us, this is a News Check, a program that seeks to explore issues that are shaping the news as we take you to different events that are also happening in Kenya's capital and other parts of the country as they happen. In studio, we also unpacking some of these issues to give you a better glimpse of what they mean for you and what impact they have for your life going forward, what you need to do to influence how this country is being run. Now, we have been talking about matters education as schools reopened for the first time beginning Monday after the long COVID-19 break for physical learning, that is. And of course, a lot has been said and done when it comes to the adherence to the COVID-19 safety protocols. Other schools are still facing a few challenges here and there. Parents are still having their own reservations whether time is ripe to take learners back to school, and a lot that the government has also done to facilitate this whole process. And that is what we are talking about. And earlier I asked you to be part of the conversation. Just tell me whether there could be any concern or anything that you would like to raise with regards to how the process of reopening schools has been conducted. Is there a school near you? Are you a parent? Do you have any concern? Do you have any question with regards to even the implementation of the COVID-19 safety protocols? We welcome your views and opinions on this conversation at Serfine_Achieng on Twitter, Serfine Achieng on Facebook, and at KBC Channel 1 is our official social media platform. And just allow me to take you through the list of directives that the Ministry of Education in collaboration with the Ministry of Health actually gave schools to put in place, just as a reminder of what some of the schools are currently doing or had done in preparedness for the reopening of schools. They include ensuring that everybody who is within the school compound is wearing a face mask all the time in the right way. And of course, schools were also required to, ahead of time before reopening, provide adequate hand washing points with water and soap. And for schools facing a challenge, probably shortage of water or something to that effect, they were advised to invest in enough hand sanitizers, restricted movement in and out of these learning institutions, of course, and also ensuring there is mandatory temperature checks, especially at the points of entry, and also maintaining social distance. And also schools were required to create an isolation facility in case there is a suspected case of COVID-19 or any health issue that may arise, especially during this sensitive time. And of course, co-curricular activities, assemblies where learners go, like say 1 day in a week or twice a week to get updates on what is going on and what they need to do, have been banned. Parents' meetings are also being restricted. And of course, school buses have also been advised to carry half their capacity, and schools also to serve meals in shifts. And it's a list that I can go on and on about, but these are the main issues that actually have really shaped conversation in the past few days. And in studio, we have been discussing this with the principals of MGA schools. His name is Fredrick Muingi. And Fredrick, before we just went to Mombasa to talk about the plight of healthcare workers, you know, even if we have all these safety protocols put in place, there are still parents who are a bit they have their reservations. It's not school fees, but they just feel, let me wait and see. Let's see how long this is going to take, and let's see how safe it is before I can allow my child to go back to school. Have you faced such unique cases, and how are you dealing with them?
Yeah, as I just said, these measures we had discussed and said that they will require a lot of funding, isn't it? And we have said many schools have tried, but we can't say we are at 100%. And there are parents who are not willing to take risk at all. There are parents who are saying that the safety of my child is more important than anything else, including the education itself. And they would prefer even keeping the child at home for this period of time until probably they are assured that something has come up that will tame this virus from spreading from one person to another. Maybe a vaccine or something has happened. Their parents, especially even in our school, I've got calls from parents asking me, what other options do we have for those of us who are not willing to risk our children?
Are there options? The Ministry of Education was very categorical that all learners should go back to school.
It's very clear that children need to go back to school. And the purpose of children going to school, I think, and in my view, is to get education, is to be educated, is to be taught. And for me, I believe that for the period when schools were closed to the time we are opening, there are lessons we've learned, especially on the aspect of remote, we call it remote learning, where we are able to teach the children while at school, but the children are at a far distance. That is what we were able to learn, that it's possible for us actually to deliver the curriculum to the children while at home. Of course, the challenges that came with that is that there are parents that were not able to partake of that program based on probably lack of proper gadgets, lack of proper supervision of the child or guidance of the child at home, or even because of many other factors, like they have traveled to up-country areas where we have no proper connection of internet and such. But a bigger percentage of our children were able to undertake these lessons, and we were able to realize that it is actually possible for us to be able to teach and be able to move the curriculum even actually faster than when the children are in school, physically in school.
So during the long COVID-19 break, what you're saying is, you know, you really explored the online learning platform. Did it work for you?
Worked perfectly well, especially a class like the Standard 8, where we had you know, big percentage. We had actually almost 90% of the students online. We were able, many of the classes were able to cover, many of the subjects were able to cover the syllabus. Because when you teach, when you present online, you see, you focus on your presentation. We do not have these other issues that come up when you have the children in class, where you have sometimes you are a disciplinarian, you have to handle cases that come up in the class. Sometimes there are jokes. Some children even crack jokes in class, and that takes time also. But when it's online, we realize that the teacher is able to focus on what it is that they are presenting and be able to move it faster than when. So what we have said, because I've got several parents who have called and expressed that concern and told me they are not willing and they are not going to take their children. You see, the means can say take the children, but as the parent, the child is yours. So you cannot say I will take my child to school because the minister has told me, if you are not willing to risk, because it's a risk. So what we are going to do as a school is that we are going to continue offering online classes for the parents that may not. We are encouraging all of them to come to school. However, for those that are not at all, saying that they cannot be able to take their children for physical learning, our online school still continues.
Is that even allowed?
Okay.
Won't it come with consequences?
We may not be able to say it's allowed or not allowed, but for me it's better than that child staying at home and doing totally nothing. I saw the children that were engaged in online school were safer, even when we had this break, than those that were just left out there with no learning at all. Because these children wake up, they know they have lessons. So what we are going to do, these children will be waking up in the morning and dressing up in their uniforms. And the parents that are going to take up this have to assure the school that they are willing, number one, to provide the infrastructure required. That is the proper gadget, that's a smartphone or even a laptop. They are going to assure us they can be able to provide adequate internet in their houses. They are going to assure us they are going to provide the support that we will ask them to provide. They are going to assure they are going to provide a conducive environment. So what is going to happen is that when they wake up, they will be dressing their uniforms. And then we are going to set up a proper unit in the school simply for conducting those classes. And then we'll be able now to pass information to the children while at home. What we are not going to get in that is the personal touch, which we can say is a sacrifice the parent is willing to take. You know?
But the online exploring the online platform to facilitate learning is something that all of us agree is a step in the right direction. But just looking at how it was implemented even during the COVID-19 season, we're still in that season, but I have a feeling we are actually trying. No, we are trying to move on.
Yeah, sure. We are trying to get ourselves out of it.
There was that feeling that it was creating a lot of inequality when it comes to the education systems. A lot of learners were locked out of accessing education via that platform. I'm talking about those who could be in schools where not even in schools, in places where we do not have electricity, we do not have those mechanisms that have been set up for online learning. If we continued with that particular option, then a lot of learners were going to be left out. So that's why probably we are reverting to physical.
Sure.
So what would you say about...
And I would want not to be misunderstood. We are not saying online learning is far much better than physical learning. As I said, physical learning is actually the way education is supposed to be, because when a child, especially at the basic levels of primary school, kindergarten, the children require to be in school so that they can be able to have that personal touch with the teacher. The teacher will be able to even not only teach the curriculum but also shape the behavior of the child, instill values in the child, and so on and so forth. So physical learning is not anything that we can undermine. It is what needs to happen. And we are actually encouraging as many parents as possible, just like the government is doing, to take their children to school. But I'm just saying, for the parent that is so skeptical, that is saying that for me, I cannot risk, and they have come out publicly and told us. It's not us looking for them. It is them looking for us and asking, say, if there's no another option, then my child will sit at home and wait until maybe you have a vaccine or something. That's the only time I can take my... And I can tell you there are many in Kenya. There are many parents of that kind in Kenya. So would it be better if we let the children just stay at home idle? At least for now, it's better because we have an option. If you are not able to avail the gadgets for learning or the internet, there's an option of physical learning. Take your child to school. If you can avail all these things, as I said, the parent has to assure us that they are going to provide everything we require for that learning to take place. If that is assured and you are skeptical that you can take your child to school, then as a school we are available to ensure that your child is not idle. And that's why we have come up with an infrastructure to ensure online classes are being undertaken for the classes where parents have requested.
All right. Mwalimu, whether that arrangement is permitted or not, that's a question for another day.
Yeah.
But then let's talk about, the plight of parents when it comes to the school fee menace. Some say that schools have given them some very outrageous fee plans with added costs. Maybe schools are trying to manage to survive and adding costs, extra costs for this and that here and there. I don't know, is there a way that this can be addressed also, that even parents can be protected from schools taking advantage of the COVID-19 consequences to sort of have additional costs and even the implementation of the safety protocols to increase the burden of school fees for parents?
I am a firm believer and actually concur with the Minister of Education that children need to go to school and need not to be sent out because of maybe school fees, especially in the public schools, given that they have capitation that come from the government. They don't need to levy parents on development, and that those things can be held, or they can hold on those things and be able to focus on, the child and be able to recover that what the child has been able to lose. In the private sector, where the school has to run on finances, it means that the parent has to pay pay the school fees. It is wrong for a school to take advantage of this period when we know very well that as much as much as you want to revive yourself as a school, the parents out there are also equally affected. We have so many parents, by the way, who are actually struggling. So it is wrong for our school to take into, adding so much, money on top of what the parents were used to paying, just to get some advantage, to take advantage of the situation. For us as a school, we have actually reduced the school fees for us because, as you read here, activities, extra, we call them co-curricular activities, have been stopped. I believe it's extra activities where we are involving people coming from outside to come and train children, or where we have schools are meeting for such activity like music festivals and sports tournaments and such. Because of that, we have been able to, from our fees, take away activity like skating, where we had to bring specialists from outside to come and train. Things like taekwondo, where we have to get people from outside because we don't want those people to come from out and come interact with our learners. However, inside we are still going to be conducting games activities. We are still going to be engaging children on talent development because that is what we feel an holistic education is all about. But so there was a charge attached to like skating, a charge attached to taekwondo and the rest of those kind of activities that we run as a school. So those charges have been dropped, meaning that the school fee has dropped to an extent. So that is the reason why we did this, mainly not because the government has said these activities has to be stopped. Mainly was because we also understand that the parents also struggling. So we are trying to make it actually more convenient and more comfortable for the parent to be able to bring back their child. As I said, it will be also important for schools to understand the parents are affected and be able to just give them some allowance. Do not be so strict that if you have not paid the school fee, the child has to be sent out. Let us understand that they are affected. Let us understand what they are going through. Let us walk the journey with them. As the parents support the school, let us support the school also support the parents, so that at the end of the day we can come out of this season and all of us are winners.
What did you tell parents who are currently facing this? They've just taken their children back to school and they've realized there are quite a number of additional costs that have come, and they're really concerned about this. What can they do?
You have already taken the child in school, and the additional charges that are there, I can't tell you to rebel. That's one thing. So you have to really know that the school management, probably there was a good reason why they were able to add some of those charges. Say, for example, a school that did not was not able to finance these measures probably would have had an extra cost to say this for COVID-19 preparation, because they need also up and above catering for their day-to-day expenses. They can also be able to remain a little bit of money to ensure the safety of the children. So it's good for the parent also to consider what could be the reason why this charge has been put in. Do not view it negatively from the onset. It's important to look at it and critically know probably there's a good reason. Engage the school if possible, get to understand why do we have an extra cost here. The school will be able to explain to you. If you are contented that it was important for that charge to come in, then just go out there and see to it that you actually pay. If you have difficulties, engage the school also. Let the school know that you are facing difficulties and you have a plan to pay. However, if that is not the case and you find the levies that have been put in there, you are not able to cope up with them, and that's a private school.
Or they are not making sense.
They are not making sense to you. Then my advice is we have options, and it's always good for parents. And I tell parents it's not wrong for you to move your child from one school to the other, because if you find a school is not, the values of the school or what the school is expecting of you is way above what you feel you can manage, then why not seek an option? Go to another school that does not have that kind of a levy that is disturbing you, and where you feel your child will be comfortable. The same, if a school is not giving you what you look for in a school, it is important for you to make a change, because you don't make a change and you spoil your child, or you make your child not get the quality education that will prepare them for a better future, then at the end of the day, the blame will be on the parent. It is the parent who carries the greatest blame when the child gets or a child goes through the wrong education. And it is very bad for, you know, a child getting the wrong education has very adverse effects at the end of the day, because a child goes to a school where discipline is not taken care of, and the child learns these behaviors that would make them finally maybe sent out of school from high school and such. Who is to blame? Who bears the burden?
In that particular
It is the parent. So at the end of the day, I tell parents, assess the school. Even as you go along, don't just wake up, prepare child, go to, and then you are at work, very busy. Please, it's good for you to know what happens in school. Visit the school. See how they do their things. Engage the teachers, engage the administration. If you feel the child, that school is not preparing your child for a future that is desirable, because you can tell whatever is happening to the children today is setting a foundation for them on which they will be able to either become of an impact to their lives or to the society and to the country. If you can't see that path properly drawn, then why not consider, okay, you can raise a voice and say, why not change here? If you find your advice is not being taken, please look for an option. Yeah.
All right, well said, Mwalimu. Let's talk about, you know, how private schools also affected when that directive was issued, when, you know, the Minister of Education said when schools reopen, they will go back to pick up the syllabus from where it was left past first term. Other schools had already invested massively in you know, learning online. There was a lot of complaints that were raised about that. Now that schools have reopened, for your school, for example, that really invested in online learning and then, you know, taken steps ahead, what is it that is happening currently? Will you start from scratch again, or what is happening?
Okay, sure. The government has pronounced itself the fact that learning has to, and the break that we had is not actually being considered for now. Okay, the learning that happened between the break is not being considered, meaning that what we did in January, February, and part of March was first term. Now we are getting to second term. So it's like we are starting from where we stopped.
Has that affected you in any way?
It has affected. But I can't say not to a great deal. At first, I thought, I did not buy that idea. At first, I was against it, because I thought if a child has been learning, because there are two groups of children in every school. There are those that are on the online school, there are those that were not able to join. So those that have been learning, to me, I thought it's important that if we go the full year, as they come back, it's important for us to reassess the children or even examine them. And if we find that they have satisfactorily, you know, covered what they needed to cover in that particular level, they are promoted the next class. That's initially my mindset. But when the government now pronounced it of the fact that we need to pick, I said it will be good for us to have equality, because if we promote one child and the other one comes and they find themselves in the other class and they used to be the same class, you can imagine the psychological torture in the child that has been told to repeat or to go to the same class they were. The other one may also, you know, develop that spirit of superiority. You know,
like I moved on.
Yes, I moved on. You are. So I saw that it is not going to bring equality.
What about parents who paid for some of these online arrangements?
The thing is,
and then they have to go back
and pay. The thing is, the children that were on the online learning have an advantage as we talk. The young children, especially in level of kindergarten and lower and the primary and even secondary, you know, they are still developing their minds. Meaning that a child does not, it's difficult for a child to grasp a concept just by hearing it for just once, for the first time. So actually a child is able to grasp a concept and be able to internalize it if it is repeated separately. And that's why we are saying if the children go back and start with the others where we stopped, the children that were on the online school have an advantage. They will actually be ahead of the others in terms of internalizing the concepts of the different curriculums that are being delivered, meaning that they are better off, they are ahead of the others. And it's better for them and for the parent. That should give them comfort that the child is likely to do better in the exam. We are seeing it even with the class 8. The students that were not engaged the online, as we talk now, are the ones that are actually trailing behind the others. They also, they are getting it, yes, but they are not at par with the others. The others are able to do their exams and be, because we are repeating this in for the second time. So it's not a loss. The money was not lost.
What will it take for us to streamline the education sector, for us to have equality and for all learners to be at par? Because I have a feeling COVID-19 has had a big effects that may take us years to recover from in the education sector. What will we have to do different for us to achieve that level of equality?
What we can do is for us, first of all, to understand, for us who are with the children, to understand that these children have come, they are not at the same level. The teacher must understand that. And therefore, when you are teaching, like what we do in our school is that at some point, when we start the system, we teach the children together, but at some point, we are able to, because you realize now, there are children that have already had these concepts, they are just repeat. It's like through them is a walkover now. Then there are others that would want to be given a little bit more time. So what we do, we try to, at some point, not throughout the year, but at some point we try to put those that are already fast in accession of these concepts in one room. Then this one will require some bit of time. Like we can take a term and say, this term is for bringing up the children that are quite low. And you see, so what we do, we ensure that these ones are given maybe teachers that are patient, because there are teachers that are patient, others who are not. Number two, they are also given more time. You know, they are not rushed, they are not moved very fast. So every concept is explained properly. And, you know, as the others probably engaged with revision work, in discussions and such. So by so doing, we are able to bring up those learners that were a bit low to a point where you can tell now they are almost at par with the others. And then from there now we can prepare them, especially the candidates now for the examination. So that's a strategy that we do, and it works miracles, because we realize when you put these children together, sometimes
it's not fair for
there are some children that are lost in between, because you come as a teacher, you ask a question, the first learner is listening their hand, you ask, you move on. The other one there has not even understood a thing, so it's just lost in the classroom. So by so doing, you lose some learners there. Or another teacher who is very patient will concentrate on the one who is not. So others lift their hand, but they don't have the one to lift their hands. They go to the one that is not lifting because they want to come up with them.
Encourage.
So what is happening now? The one who is very fast, see, they are just there. They just sit there and watch as you bring the others up. So we thought it would be better. And at the beginning of first term, we cover the syllabus when the children are together, but then we're able to assess and see this one require more time. So we put them aside and leave them maybe in second term. In that term, now all of them are prepared for the examination.
All right. Yeah. Is it right, for reports we had about schools, you know, sort of putting punitive measures on learners who did not participate in the online learning arrangement during the COVID-19 season, that, you know, there are others who even refuse to readmit some of these learners back to school?
We have seen that. It's quite unfortunate. I've seen it on the news media. And I think at the end of the day, it narrows down to what are the values, what is the philosophy of your school? Why does your school exist? There are many people that are running schools as purely business places, purely, that they don't even care. They don't care about anything else apart from the fact that the parent is coming and paying money. And as I said at the beginning, a private school is a business, yes, and our business has to attract the customer, and attract customer means you have to produce a good performance, isn't it? However, we have to go back and ask ourselves, what is the vision of our school? Why does our school exist? Is it just to produce good performance and therefore be said to be the best school? Or is it to bring all children, because every child has a right to education? I tell parents in our school that we are not going to refuse to admit a child based on the fact that they are not getting the grades we want, if their years are right for that class that the child wants. So we interview the child, yes, but we are not going to refuse to take your child. Reason is because when we refuse that child, where do we want the child to go? Would you want the child to go and get lost out there, become what? You get? We can add value to every child. And that's why in our school, we work with things we call targets. We don't come and tell every child you have to be number one, that you have to get 400 marks. No. Every child, when they come to school, they are allocated their specific target. If you get 200, or if we do your exam and you get 230, we'll tell you next time, can you get 250? We're not going to tell you get 300.
400 marks.
Oh yeah, we get
so schools, you know, really need to think about their value system.
You need to. It's the philosophy of the school. Why does your school exist? If you can only catch that and be able to be committed to it, then you will be able to know. And you know the philosophy, and that's why I said parents need to consider their school, because one of the things that our parents are supposed to look for in our school, if you are to take your child, madam, something to a school, if you go to that school, find out what is the value system of that school. What do you value? Do you just value when I pay my money? Do you value my child? Do you value my child? Is my child your concern? Or is it the money I pay your concern? You get? So if that is right, then we'll not have those things of a teacher, an administration chasing away children by the fact that they never joined online school. That is quite weird. And to me, it's detestable, and I cannot support it.
All right. I'll take you back to online learning, because we are talking about a new normal that we may not run away from anytime soon. We have to embrace times as they come. Right now in our education sector, COVID taught us that we should be thinking about investing more on our online education, our digital learning mechanisms. I'd just like to hear from you as one of the stakeholders who actually explored this opportunity, and you say it worked for you. What do you think are some of the lessons we need to learn as a country? What do we need to change? What gaps do we need to fill when it comes to digital learning and making it work in this country?
Okay, the first thing that I think we need to first understand or you know, be aware on is that the online learning was able to expose the weaknesses that are there in our education system, and especially in our there's the private, yes, but also mostly in our public schools. I can tell you for free that I've not had, as of now, any public school that was able to facilitate any kind of online learning, apart from the TV lessons that were offered by KICD and such. But in school, where public school has set up an infrastructure to ensure that their learners are engaged, it was very difficult. Reason, because the schools are not, the infrastructure, the technological infrastructure in the school is not set up. We started by hearing there's going to be what we call a laptop program, a tablet program starting from grade 1, and that was going to proceed. There was a promise that was given at some point. It never took off. And even for the places or schools that were used for piloting and this was set up, then the management of the same system was not properly done. The gadgets got spoiled, and we were just in a mess. So that is to mean that the government has to take an initiative to empower and also equip the schools with technology. You know, equip them with tablets. Maybe they can set up a laboratory and be able to equip the tablets with necessary content that is equivalent or that is, you know, adequate, and also, you know, which is of value to the children. And the school is supposed to also develop capacity within itself for the staff to be able to take up and be able to carry out online learning. So for us, we learned that it is important, because even us, we were not very far from the public school before, because we were not seeing, because the children are coming to school every day and we meet them and teach them using chalk and you know, the whiteboards and all that. We did not think a time would come when online learning was going to become very necessary. And therefore, we had done a little bit, because we had already purchased the tablets for our learners, especially because of the CBC and all that. And those gadgets became very, because when now COVID-19 struck, we called all our teachers. We trained them, because the teachers also require training. We trained them on how to deliver lessons.
You know, I was just about to also probe you on the fact that when we were having proposals to really go full-blown on online learning during the COVID-19 season, in this season, I mean, had we thought about the need to take our teachers through a system where they can be able to deliver learning via the online platform? Because a majority of them in their training,
that doesn't feature.
It doesn't feature anywhere.
Yes, so actually, it was a big challenge, because, and the reason why I tell you our online school was able to pick properly is because we did not just tell teachers go and teach. Before we rolled out our online school, we were able to come up with a good plan. The good thing is that we have a very elaborate IT department with very qualified and specialists. So we were able to bring all the teachers. So an elaborate training session for not one day, it took almost a week. So that the teacher can know how to work with these gadgets, how to be able to connect to the Zoom, how to be able to even putting on the Wi-Fi on a gadget. You know, it was just everything. Then we did not only talk about how to operate the gadget, but also how to make presentations online. Because presentations online are not like presentation in a classroom. You don't go to before a computer and start shouting this if you are shouting in a classroom where children are, isn't it? So we also taught them on preparation of slides, PowerPoint presentations, how to be effective in making sure that that presentation you are making is also, the children are not with you. So if you are not illustrative enough, the children may actually have a problem catching the concept you are presenting. So how do you make your presentation illustrative to the child so that the child can be able actually to be impressed by what you are doing and be attracted and want to learn more? So it was all about training, and which I know if we are to really say that we are a country that is moving towards technology and embracing technology in our learning, then a lot has to be done in equipping the schools, and not only equipping the schools, but also training the staff to be able to manage online learning, and also not only the staff, but also the parents. Yeah. Because the process, the home environment. In the process of our online school, we kept only meeting with the parents to enlighten them what we expect. We want a conducive. We don't want your child to be learning here and the TV is on here or at on the back of the sitting of the place where the child is learning. Creating a conducive learning environment for the learner. The parent in online school has also to play a big part now, because the teacher is not at home. So the parent is the one now to check the homework, is one to ensure that the child actually, when they sit, they are there throughout. Because if the child I'm teaching from school and the child is at home and they stand up and go, will I have no control? So who is supposed to do that? Is the parent. That's why I said in even the online school we are going to carry out, the parent has to be very, very, very instrumental in ensuring that we succeed. If the parent is not, then we'll stop their child, because we also want to be of value. If we are not of value, we will not be able to continue. Fredrick, do you think there is a need to, conduct education in concurrence, that we have physical and online going together as we move, so that we do not miss the gains? That's now you are. And it's really ironical that I'm saying gains from the COVID-19 pandemic. Sincerely, because I also was a bit worried when you mentioned at first that will us teaching the children online be allowed and all that. No, as per now, I based my argument on the directive by the Ministry of Education that all learners have to report back to school. However, when you look at it keenly, you realize that if we had already emphasized on the fact that people need to start looking at, moving education from physical to even online learning, given that there are eventualities that come like what faced us, then it would be wrong for us to say schools that had already started moving towards that direction should stop and only engage children physically. In fact, for us, we are saying, even when the children are in school, and that is a project which I don't know, it's a project that the school is already planning, that even when the children are in school, that we can have them not only carry physical books, but have this content, education content in mathematics, science, and whatever, installed in the gadgets, and the child in class, the teacher can say, get your gadgets, open mathematics, this and this place, this is what we are doing. You understand? And that even when they're in school. So our aim is every child should own their own gadget. We have to move on from physical books. We have to move away from the teacher-child book. You get? So that we do not lose, as you say, the gains that we had already. Ironically, so the gains we have from the COVID-19. No, they are there. They are there. So the thing is, that's very ironical, for us as a school, we are starting from the children that have of parents who are very skeptical. That's where we are starting. But going forward, as I said, even in the physical, we'll find a lot of a lot of technology being infused in our learning and teaching.
All right, I want us to talk about the health system in the school. We focus on just imparting education, imparting information on learners, and forget about the need to have their safety also put in place. And COVID has taught us a lot of things. And this particular time, I just want us to look at that particular matter, and just looking at the schools we have in our country right now. How many would you say have even a nurse, a professional, somebody who is qualified as a health professional that is stationed to address the health needs of the staff and the learners in that particular school? Have we invested in that sector?
There's a bit of conflict in that, because you say that we have, given ourselves and put a lot of effort and energies and resources into teaching the learners, delivering curriculum and so on. But on the other side, the safety and the health of our learners has not been very, especially before COVID-19, something that we were not actually thinking about.
Even the school dispensaries, the drugs you'd find there, maybe just the usual painkillers, and you didn't find, these are the drugs that may be needed for that. For
mostly it's a painkiller you find.
Just a painkiller. And that painkiller is used for everything. You have a flu, painkiller. You have headache, painkiller, and it's everything.
But you see now, what I can also say, madam, is that before COVID-19, the reason why you say we were where we were is because a school, it's an education institution. It's not a hospital. So the only thing we are supposed to manage is a kitty. For what? For in case of any emergency in the school, or for emergencies, let's say. However, when there are sicknesses and such other things, we expect that there are institutions that are well equipped to handle that. So if a child is sick in school, we expect that the child is supposed to be moved to a hospital, isn't it? Maybe the parent can be called in to come and take the child to hospital, or if it's seen to be a bit serious, the school can actually be able to facilitate that as they inform the parents. But with COVID-19 now, we have been required to ensure that we are attached to a hospital or a health center that is not beyond 10 kilometers from where the school is. So, and I think that's a move which is very welcome, because now every school will be knowing, in case of a health issue in our school, we can be able to reach this particular hospital. Probably the hospital has an ambulance and such, and we can be able to collaborate, because we can't bring hospital to school. So we can only be able to collaborate with health institutions to ensure that the health issues of children in school are catered
But
for.
During this health crisis, is it necessary to have somebody who is qualified to be within the school compound?
And especially boarding schools, it will be very necessary for us to have a nurse who is qualified, so that, because even checking temperatures and such, even you go to some places and the gadget, that thermogun is used on you, and when you look at the temperature, you can tell that these people have not been trained properly on how to use it. It's not working.
It's done for formality.
So we need to have somebody who is properly trained, who can be able to take up the health matters of the school. So any boarding school, for us, we have already done that, but any boarding school is undefined. And I think it's a requirement by the government for a boarding school to have a nurse, a resident nurse who can be able to take up the health issues of the children. It may not be achievable 100%, because, as I said, schools are different levels, but we encourage, if you manage children in school, please have a nurse so that you can be able to take care of the issues that might arise.
All right. There was, yesterday, our reporters were traversing different schools to see what they were up to. Schools were reopening, and I remember a report by one of my colleagues, Kamche Menza, she was at Jamhuri High School, I believe, and the principal was saying, learners have come back, and what they're doing this week, for a better part of this week, is counseling and just taking the learners through that process of just debriefing. I don't know whether you think this is relevant, just because it's been a trying time. There are others who've lost their parents or their close ones, during this pandemic, and COVID is a scary matter on its own. Is it relevant perhaps for schools also to set up measures to just allow learners go through this season in a better way? Do you have plans for like that as a school?
Yeah, as I said, that we understand the learners are coming from home, and the environment at home was very different. Remember, at home, the parent was very comfortable that it's me and my 2 children and we are okay. So rarely did the parents take time to really talk to children about safety measures against COVID-19. So the school has to take up that responsibility. Immediately the children come, the first thing, of course, you don't train them in a scary manner. I remember when we told the children that they were to go home when President announced the school closed. Children started crying.
There was a lot of scare.
Yeah, there was a lot.
Fear.
That one is now understood because even us who are delivering the message to the children, we did not know what we are talking about. So we might have delivered in a manner and delivered the message in a manner that the children were so scared. But now, the kind of training that we need to take the children through is not to scare them, but is to tell them that for your safety, there are a few things that have changed, so that we can be able to remain safe. Because at least now every child knows there's COVID-19. They may not understand exactly what happens, but they know there's something that is being feared, you know. So tell them. So that is what we are saying. When the children come, we start there. Orientation on the safety protocols. And if you can be able to go, let's not take them through the whole booklet from the means of education. It's too much for a child. Let's take it and narrow it down to a few points, like 10 points. You know, handle the issue of mask, handle the issue of sanitizer, washing of hands, handle the issue of keeping distance and not getting close, and the sharing of materials. You get simple precautions that the children can easily absorb and be able to exercise. However, if we go there with the whole booklet and the children, temperature, if it goes at 7 point this, even those details are not very important to the children because we are the one checking. So if I find your temperature is, I don't even tell you I just tell you just come. You know, you handle them in a manner that you don't scare them again. Because as much as we are very, very keen to ensure the safety of the children, which is number one, we also must be careful not to lose the purpose of our school, which is education.
All right. Fredrick, we're just about to wrap up this conversation, and as we do that, I'd just like you to talk about the way forward. You've raised concern about how you feel private schools were left out as we battled with this pandemic. And also, I'd also like for you to talk about, you know, the investing in the health system in schools. As we wind up, probably as you're parting shot, what do you think needs to be done different so that we do not face challenges that we have faced in the private sector when it comes to education, and also schools are not really lacking in these essential services, essential workers, and setting up their health system in a way that learners are assured of their safety while they're in school. What is it that probably can be done to address these issues? A lot
can be done. The first thing that I think I can talk to the school management, because especially in private schools where school has to collect school fees from children and be able to expense it by taking care of the children, ensuring that the welfare of the children is well taken care of. It's important for the management to be able to know that eventualities come. And therefore, even as you spend the monies that the parents pay, it's important for you to keep aside some finances, so that in case of anything, you are not found, you know, with nothing, because that is what caused many schools to close. Because you spend whatever had come with the parents up to the last penny, and the schools are being closed. So you are not able to think beyond where you are standing. So it's important for budgeting to be done in a manner that allow some allowance for you to keep aside some little money. For in case of anything, you can even cushion your staff. You can be able to, because now we've realized that private school is on its own. Then the other one is the government, because now all of us, all schools in Kenya are under the Ministry of Education. It's important for the government to think about the private schools, and especially at times has that what we got ourselves into. So that in case of any eventuality like this one, at least let's see the private sector be considered as also an important player in the education system by, you know, somebody needed to listen to the private schools. We needed to hear some. The minister never talked about the private school as far as cushioning them or their survival is concerned. You know, the only thing we could hear is don't send children away. We need the government to understand that the private school is part. And the role the private school plays in supporting the education system in Kenya is very critical. Without the private schools, it will be difficult for all the children in Kenya to go to school. So the government should realize that the private school sector is part and parcel of what they are doing. They should collaborate with the public school, and whatever grant the public school is getting, they should consider, not maybe not at equal amount, but somebody should go to the private school for cushioning. And then also now, for the schools themselves, it's important for us to learn that the lessons we've learned from COVID-19 as we move forward, that we do not want to lose what we've gained. As we talk about the health issues, the washing of hands, for example, should be something that, even if we are told there's a vaccine for COVID-19, let the washing of hands be a thing, a practice that gets into everybody in the school. Let the measures that we put in place to combat COVID-19 be our lifestyle going forward. Then let us also see that we are also trying to invest in the infrastructure in our schools.
All right.
Let us not have a school that's just opening its gates and closing, and whatever you get is what you consume with your staff and the children and that sort. Think about, can I have maybe, as you said, a dispensary at one corner if you have a compound, which can treat the community and which can also, you can actually spread your wings into more valuable industries that would also support the education sector.
All right.
Yeah.
Fredrick Muingi, the principal of Mwiki Goodhope Academy, currently he's saying is known as MGA Schools. Thank you so much for creating time for us on a busy day like this when your schools were reopening. We appreciate you creating time and for sharing insights on what is happening as schools reopen and some of the things that we need to do to ensure the safety of learners in this particular period. We have been talking about the schools reopening amid the COVID-19 pandemic. We appreciate your company. This has been News Check. My name is Serfine Achieng Ouma. I have been doing this together with Lucy Mwaura and Simon Karotha. We are now paving way for Suleiman Yeri for the Swahili version of the program Tamrini. Do stay for that.
Muone Faisal ndio huyu aliwekelea bid ya TV na ndio hii anaenda nayo. Faisal, hebu tuambie ni vipi uliwekelea bid?
Nilienda kwenye website ya QuickBid. Nikatizama nikachagua kuwekelea kwenye TV. Sasa niliwekelea mara 3. Nikaja kwa mshindi, nikakutana bid yenye imenifanya kwa niko mshindi ilikuwa ni 168. Sasa leo nimekaitwa nikaja nichukue TV yangu.
Haya Faisal, mali yako. Tukusaidie. Asante.
Jiunga na QuickBid ni rahisi. Enda kwenye M-Pesa, bonyeza paybill kisha weka business number 4032353. Kwenye account weka kodi ya bidhaa unayotaka na bid yako ya chini zaidi. Kwa mfano TV 16, kisha weka shilingi 20 tu kama idadi yako. Weka bid yako pia kwenye www.quickbid.co.ke. Kumbuka, bid ya chini zaidi ya kipekee ndio ununua. QuickBid, bidhaa bora kwa bei ya chini.
The magic of FA Cup is back with mouth-watering ties as the Premier League and Championship clubs enter the competition in the third round. KBC Channel 1 will ensure you don't miss out, live and exclusive on your True Sports partner from the 8th to 11th of January 2021 as we kickstart the new year with you in mind. Save the dates for the best and route to the finals. Next on
Jiulize, wewe kwa siku unadanganya mara ngapi? Mtu anakupigia uko town, anakuuliza uko wapi, unamwambia uko sehemu fulani. Angalia, tunatengeza mjitama gani? Wale watoto wanakuwa nasikiliza na wanakuona. Wewe utamwambia, sasa usifuate vile ambazo mimi nafanya, wewe nisikilize maneno yangu. Hapana, mtoto anasikiliza kile ambacho unafanya.
On the next episode of
Aisha, suniambie nini kinachoendelea?
Masudi mpeleke General Hospital huyu hebu.
Unipeleke General Hospital kwani mimi ni mgonjwa?
Kwanza mpatikana kwa ajali kubwa sana.
Mambo ya pesa yatoka wapi? Jana ulizungumzia kuhusu nini wewe? Si uliambia mzee wangu kuhusu maamri?
Masudi hebu mwambie nipatie pesa zangu.
Mtoto wangu basi.
Pole. Pole.
Tonight on KBC Channel 1.
We'll never stand aside while our brothers and our sisters get pushed over by the wayside. Forever stand firm.
Everybody have thoughts and affairs, so everybody have moments to share. Everybody needs someone to love.
I say on the first day when I look upon the earth, it was without void, and like a lion draw him shout.
Turn up and let the music play. 100 on the highway. I ain't taking no calls on my struggles in the rearview mirror. If you ain't going my way, then you can get...
Next on.
What did you find out?
Ule dem ni nani?
Hii lazima nikuwe.
Nini? Tuchukue simu. Is there a meeting I didn't know about?
Jazz, you've really changed.
Glenn, I'm not easily swayed.
Says the person stalking me.
Nobody usaidizi kadu.
Doza?
Unajua baadhi bibi yangu baadhi aliyataka osha.
Sasa mimi naingiliaje hapo?
Ama nataka baadhi niseme ile mambo yako wewe na Sira.
Hapo ndio shida imekufikisha. Sonia.
Sonny, you guys know each other?
Thought you said you're not working with Nancy anymore.
I'm not.
Glenn.
There's something you're hiding.
Jazz, I have never met your mom.
I didn't tell you she's my mom. You're fired.
Simujifanya ni washindani. Ngoja siku ifike.
Mimi ni paka mwitu nitakupa pura.
Ni usiku sasa matatizo.